Okay, so this is our 1990 deep breathing or breathing practice, and we're just going to be introducing this to either decrease some compression in the low back or to really introduce you to some quality breathing skills and concepts that you can apply through a wide range of exercises. So we're using this bench. You could use a chair. We want to have a height that's close to around a 90-degree position, so somewhere in this range here would be fine for you. You could also put your feet up against the wall, and that'll work well for this as well. We can use a foam roller or a yoga block or a ball or a towel in between your knees. It's just something to kind of squeeze on with about 5 pounds worth of pressure. And we're using the feet anchored against that bench to just help give us a platform to tuck the tailbone up towards the ceiling. Okay, so with that in place, we want to check our abs are relaxed here still, and then we can bring our arms reaching up towards the ceiling and just kind of reach those shoulder blades up off the ground. As we do that, we can start to initiate a really deep breathing cycle, so something like 6-second inhales and 6-second exhales. And we want to feel that the shoulder blades reaching up off the ground is making us a little bit heavier into the ground at the mid-back. And this posterior pelvic tilt that we're getting from lower down is helping us to kind of keep the low back really flush and square onto the mat. So in that section between mid-back to low back to the belt line, everything is just heavy onto the ground right there. And now we can focus more on our breathing. We're going to inhale deeply, exhale as fully as you can. And I want you to think about a balloon, and the way that you would blow up a balloon, it's going to expand to the side, up and down, and creating length evenly. And this is what we want to get out of our lungs and our chest here as well. So take that breath in whatever direction that you feel it doesn't really move as well, and just prolong those inhales. If you feel some stretching, use this position and use your breath to get that area to stretch out. And in particular, this is a great position for bringing that stretch into the mid-back, low back, and belt line area. So trying to kind of target your deep inhale down into that space can be extremely helpful. Okay, so that's our supine 90-90 breathing, and yeah, great exercise for introducing some of these breath concepts. Fantastic for our rehab clients who have some low back pain, but also really good for those who have some hip tension and knee pain at times, or just like hypersensitivity of some of the leg muscles. So we're basically trying to take a lot of tension down in that lumbar area, take some pressure off the nerves there, and a lot of things are going to start to function better when we're doing that. If you do feel like it's hard for you to get your back squishing flat on the ground here, or you feel a lot of stretching when you try to breathe into that area, that is really good for you to try to keep continuing and work that out. Okay, so this could be in your repertoire for quite some time. It's another great exercise sometimes for before a workout. If you're coming off of multiple days of activity and you're feeling a little tight going into things, you want to loosen things up quickly. It's also a great one to do as a finisher or at the end of a strenuous workout or practice or things like that, or a long day. You just want to take some tension out of your back even before you go to sleep. So yeah, really widely applied, fantastic exercise that has a lot of benefit. Hope it helps.